case, we're gonna use some type of tibial psoas, rectus femoris, right? Muscle energy techniques, again, generally speaking, we're correcting anterior, posterior. Remember I told you with in players and out players, we're really kind of almost pushing them over. And again, not really covered in this course. It is in your book, it is in that reading. There is an interesting little concept about this, the high velocity thrust. It basically tells you two things. So you put them in a position, I believe it's slight extension, abduction, and internal rotation, which is a open pack position for the SI joint and a closed pack position for the hip. Why do we care about that? Why does that matter? So I'm getting ready to, so what a high joint thrust is I'm gonna lay you down, you're gonna hold on, I'm gonna put it in that position, and I'm gonna yank.
For distraction.
High velocity thrust. So why would I want the hip to be in a closed pack position and the SI to be in an open pack position?
So that when you pull that it...
That's right, right? So open pack position is where the ligaments are loose so they can tolerate a stretch. So if I'm saying the SI is the problem, I put the SI in the loose pack position or open pack position, so when I pull, the motion occurs there. I don't want to dislocate their hip, so I put the hip in a relative stable position, right? Now again, I have seen some of these. I don't usually, I usually start kind of just with some traction and then kind of build my way up. But just, that's kind of off of what we were doing, but just so you know there's that out there. So let's have someone come up on the table. I'm gonna show you how I do it. Again, the book shows it a little bit different. Again, Tim shows it a little bit different, but again, it's just firing the muscles. So let's lay on your back. First things first, there is something called a shotgun technique. The book says there's no studies to say that this is effective. I don't really have, we have a little ball we use at our place. Lay to your back there, we'll shoot the pillow. So I don't know if this is written down. So shotgun technique, again, just a little ball or a little pillow. Go ahead and lay on your back. So this is, I don't know what's going on. What a shotgun technique means is, this sometimes works somehow. We don't even know how it works. We're just kind of throwing it out there and see if this helps your hips, okay? So it's just a bend, it's just isometric adduction. So a shotgun technique is putting the ball between your legs and squeezing the ball isometrically, holding for 3 or 4 seconds, doing it 3 or 4 repetitions. Again, if we want to teach that person to do that at home, we can tell them to take their fists, right, put it between and squeeze, or I could put my own fist in there, but I'm saying this is how you could do it at home, okay? So if you're really lost, or if you think you're doing something and it tends to be making them worse, this is an option. It's kind of a basic bilateral concept. I will say, interestingly enough, just from this concept, we didn't cover this extensively, but this might have a little bit to do with a pubic symphysis as well, right? There's some gapping that goes on there. We didn't really talk a lot about that, but there is potentially, you know, if I have an SI problem, you know, the pubic symphysis is moving a little bit. So if a person has a little bit more anterior pain, or I think it's more of a pubic symphysis problem, this might be a place to go, okay? I commonly give this as a home exercise program. I give this and the opposite, which is the belt, so pull apart, kind of as just a stabilization concept. I'm hoping I do the muscle energy technique, they get corrected, and I stabilize basically adduction and abduction, okay? So that's called the shotgun technique. Again, on all of these, we're doing somewhere between 3 and 5 reps. We're holding it 3 to 5 seconds. We're doing it several times a day, right? The concept is, if I've been out for 20 years, if I do this correction, they go get in the car, they've probably rotated back. So when they get home, they've got to do it again. So I tell them to do it like morning, noon, afternoon, and night. So basically the thought process is, they're thinking this is normal, we're setting it back, we're setting it back, we're setting it back. Before long, your body might think, man, every time I get here, so maybe this is normal, because I'm in this position more often. So muscle energy techniques, it's important to teach them a home technique, all right? So again, the only other thing before we do it here, there is this, and this is where I think it was, who was it that asked that question? That is there a possibility that there are anterior on one side and a posterior on the other side? There is that concept. Again, if you get an incomplete correction, so if I think it's anterior, and let's say I have one thumb off and I do it, and now I'm only a half a thumb, usually what I personally do is I go back and push harder on the anterior. And if that corrects it, perfect, it's just an anterior. If it doesn't correct it, then I do the opposite on the other side. So there is that possibility, all right? All right, so let's see. Let's assume he is a right anterior. So if I were looking at that, I would have this situation where the right leg appears longer, so malleoli is longer on the right. I look up here, ASIS is longer on the right, so he's right anterior. What muscle are we gonna use? Opposite. Glutes, hamstrings, all right? So we're gonna pull it backward. It's anterior, we're gonna pull it backward. So an option is, we can bring it here, and we can have him hold against us. So we're gonna say, hey, I'm gonna push you up, you push down. That's an option where we're using his glute. Another option would be, I can grab here. I'm gonna say, hey, don't let me straighten your leg. This is more hamstring, so don't let me straighten his leg. This one's a nice one because it's easy for them to see how to do it at home. I just tell them put their foot in the table and dig into the table. I often like it if they're over the edge because they can kind of hook and pull. And then again, another option would be sitting over the edge. Another option would be they can bring their hands up and you bring it back down here like that. So you just push down. So you're pushing down against your own resistance. So it's good for me to be able to do it there, to replicate it exactly, but it's also important that they do it at home, okay? The opposite of that. So if I had him here and I see this type of scenario, so this side is shorter, and when I'm looking malleoli, ASIS here is higher, right? That's a posterior. So again, if this is the scenario, it's this. What are we working on there? Rectus femoris or iliopsoas is going to pull it down. So option number one would be here, hold, don't let me push. Hold 1, 2, 3, good, let it relax. We're gonna do that 4 to 5 times. We can do it in this position as well. Hold, don't let me push. Again, sometimes it's just based on how sore they are. This is obviously harder, it gives me greater force. If I really wanna try hard, if I can't get the force, I can push down here. Longer lever arm, more pain in the back potentially, but I get a little more force, all right? So it all depends upon those factors. Again, they can do it to themselves again, in this position. Now they're gonna put their hand there, and they're gonna push, right? Or they could do it in sitting, where they just lift up and push, okay? So there's not rocket science. Again, go ahead and go to your stomach. The one in your book shows something like this. I'm in this position, I'm lifting up, and now I'm saying pull down into the table. It's the exact same as the other side. If you find one's more successful for you, one's more comfortable for the patient, all of those are okay, right? Good enough? So let's practice those muscle energy techniques, just correcting an anterior and a posterior. And if you want to do an anterior and a posterior together, you can do that as well.